As normal, the meeting is being recorded so that we can share with others. If you're a bit shy and you want to ask a question, you can do it in the chat if you prefer, or you can email. So here's the agenda today. We've got Emma Smith, who is covering for our Director of Public Health, Anna, who's on holiday today. Emma is our Head of Public Health Protection, and she's going to give you the COVID update. We've got Janet Wilson from Live Well Wakefield going to give us an update on long COVID. Andrew Watt, our comms officer, our comms lead, is going to give you a bit of information. And then Dasha Farmer from the CCG will talk about vaccines for children and young people and the anti-racism movement. And then we've got some questions and concerns about access to GPs, and then a time at the end for you to ask a few questions. So over to you, Emma.
Thank you, Tracy. Hi, everyone, and I hope you're enjoying this summer break, especially with those of you with children at school. I know I am. So this is the familiar slide that we're all familiar with, and sort of looking and showing and indicating where Wakefield's current case numbers are sitting at around 360 per 100,000, and that's closely aligned to our other West Yorkshire areas as well. And you can see here that it's remained at that for a period of time, and we're just expecting that to be the current position for the next couple of weeks till we know how the case rates will respond when our children start back at school, and we see that mixing, and obviously the benefits of the vaccination programme continue as the vaccination programme continues to be delivered. Next slide, please. So again, this just sets the position where Wakefield sit from a West Yorkshire perspective, and we sort of can see that we're mid-table amongst our other local authority colleagues here. And we can see that we're slightly seeing an increase in number of cases in our over 60 population group, and some of that is been driven by sort of outbreaks and that we're seeing sort of amongst care home residents. But we, as always, will keep a close eye on that. And we can see our positivity rate in terms of the is kind of stable presently, sitting at around 12%. And that previously had been sort of up in the 50–20% area. So that's sort of positive as well. Next slide, please. And this is our lateral flow testing picture that people will be familiar. So we'll see this dip, which is largely related to schools finishing up for the summer. A lot of schools, children and families participated in lateral flow testing. So we can see that dip off, and we just await what happens when children return to school. We expect it to definitely increase initially because school children of a secondary age are asked to participate in lateral flow testing before they start school, so they'll be asked to do 2 tests as part of that process. So we will see a spike in this in September. Next slide, please. And I'm just going to move this on, Tracy, conscious of time. And this shows our sort of 7-day testing rate amongst our age groups. So we can sort of see that slight decline in case and testing rate amongst age groups, but we can still see that it is our younger age, working age population groups that remain at the top of this graph in terms of the 25 to 59-year-olds and in terms of the 19 to 24-year-olds as well. Next slide, please. I'll move us on again, Tracy. And this is a nice picture, which is also continues to show the benefit of the vaccine programme, particularly in the over 65s. But as I said, we are seeing slight increase in number of older people have COVID. And then we can see that the younger age groups, the 11 to 16 and the 5 to 10-year-olds, we're seeing less cases in that age group compared to previous. And again, that's the effect of sort of the school break, etc. So we can see the picture is improving, but obviously we're stable in terms of case rates, sitting at 360 per 100,000. So we'd like to continue to see that start to decline again. Next slide, please. I think Anna showed you this one before, and it sort of shows where our most deprived areas and our least deprived areas. And previously we've seen where our most deprived areas sort of have had a higher number of cases than our less deprived areas, but we can see now that it's sort of balanced out and all sort of areas are very similar in terms of case rates. Next slide, please. Next slide, please. And this is sort of shows you the sort of picture for Wakefield, and as you'll be familiar with, anyone that has attended this session before, this is always changing week from week, but we can sort of see the areas where have particular high case numbers this week compared to the previous weeks. Next slide, please. And this just, again, Anna will have shown you this before, this just shows that how people are moving and going about normal activities and tasks like shopping and, you know, getting out and about more so than they did. And this just reflects that obviously we'll see more movement, we potentially see more people reporting those behaviours when they're asked, where have you been in the last 14 days prior to catching COVID, and this is sort of showing that picture. And as we can see, we don't have large school-based bubbles, so that reflects the school holidays as well. So we expect this sort of to grow in terms of schools and other areas as we continue to try and get a sense of normality. And next slide, please. And this again shows the hospital data in terms of sort of the slight increase in cases with COVID within hospital, and sort of that is naturally to see that as we have an increase in case numbers, we will always see a lag in sort of hospital cases. Next slide, please. And then this is again sort of reflects the picture of the number of deaths we sadly see due to COVID, but again we obviously are seeing some deaths more recently, but far less than we have done previously. And again, this just demonstrates the benefit of the vaccination program, in particular in terms of reducing hospital admissions and obviously reducing your likelihood to pass away due to COVID as well. There always will be some people that sadly do pass away, but that's largely contributing to other factors as well. Next slide, please. And this just shows you the vaccination picture. So just from an overall district average, where first dose is currently sitting at 83.6%, and the second dose, where people have had 2 doses, the Wakefield average is sitting at 74.9%. So really, really good work there, and that sort of equates to over 230,000 people. So I think it's really good. And what this picture shows you is just where there are parts of Wakefield where the average is slightly lower than what I've just shared there, and this is where we're starting to do more work in terms of pop-ups, walk-in vaccination centres, which you'll have seen all that flurry of activity in recent weeks to try and continue to sort of increase uptake. Next slide, please. And then this, I think this is reading both doses as well. So the last slide was sort of first dose comparison, and this is the second dose comparison. So again, we have areas within the district which are lower than sort of the district average of 74%, but we're continuing to do work with these areas and walk-ins, as I said, and that's continuing to increase uptake. And again, as we have seen the vaccination program open up to the 16 and 17-year-olds, not all these individuals will have had opportunities, so that will obviously affect our average as well. So we're working closely with the vaccination teams to offer those opportunities to those age cohorts, and that is really, really positive, with a lot of people coming forward for vaccination. I think that's my last slide, Tracy, and just asking if there's any questions, and obviously we can take any questions outside the meeting and come back to colleagues as well if they wish. Do you want to facilitate any questions, Tracy?
Absolutely, thank you very much, Emma. Does anyone have any questions, or if you're a bit shy, you can add them in the chat. Let's have a look. I think there's something in the chat. One from Lindsay. She's been asked to feedback that they've had calls from individuals who have turned up at the designated PCR drop-in site for the day for a PCR test, and they've been told away and told that there weren't any drop-ins anymore and that they would have to go away and call 119 for an appointment instead. Is this right? We thought there were still drop-ins available at daily designated sites.
So Jenny is our testing expert, and I know she's on the call today. Jenny, do you want to respond to the testing question?
Yeah, so essentially the non-booking appointments were whilst we were doing our enhanced offer, and we were knocking on doors in the community and popping a mobile testing unit within the area that we were door knocking and giving additional information. So that's where the non-appointment system came from. Now that that's no longer in place, then we are advising to book either via 119 or the government website, which I've popped in the chat, which you can find from the Wakefield Council website as well. Some sites will test you if you turn up, but it's not guaranteed, and it totally depends on which team's on the day. So I'd always advise booking where possible.
Thanks, Jenny. That's been really helpful. Any other questions, Tracy?
Thank you. And then we've got, are there any more vaccine clinics planned for children aged 12 to 15 who are clinically vulnerable? I've been told that the clinics that are scheduled are already full.
I know Dasha's on the call. I'm sorry, Dasha, to put you on the spot, but with me returning from leave, I don't have the latest position. Do you have the latest position?
Sorry, I was just typing it in the comments. So yes, Amanda, the clinics are planned on an ongoing basis, and those who are 12 to 15-year-olds and clinically vulnerable will be called in by the NHS. As the programme started, we were based on approval of individual sites. We were getting more and more sites on board, so we will have more and more capacity within the area. So yes, there absolutely will be, and there is commitment to vaccinate those who need their appointment.
Thanks, Dasha, for that. I think, Tracy, it's best for us to move on. I know you've got a packed agenda, and then if there is any questions for public health, I'll happily take them outside the meeting. But thank you, everyone, for your time. Enjoy the rest of your meeting. Bye.
Thank you very much, Emma. Thank you. Bye.
Thanks, Emma.
So we've now got Janet Wilson from Live Well, who is going to talk to us about the self-management for those with post-COVID symptoms. So over to you, Janet.
Thank you, Tracy. I am Janet Watson, by the way, not Janet Wilson, because I believe there is a Janet Wilson, and we do sometimes get confused. So yeah, but thank you for that. Live Well Wakefield social prescribing service. We, as part of our COVID offer at the moment, we are running some supported self-management for people who are living with post-COVID symptoms. So next slide, please. If you just see that there's two options for support at the minute. So the first is individual workshops. So people who don't want to commit to a course can come to shorter workshop sessions. And we've tried to make these around managing the most common symptoms that people are experiencing, which seem to be fatigue and breathlessness. So they're just in an hour slots, parts 1 and 2, so they're easier for people to manage the symptoms as well. So there's more specific support there, which we've gained from help with our colleagues in My Therapy. The longer course, the supported self-management for long COVID, it's a 6-week programme. It's not a programme that's been developed specifically for people who are living with long COVID. I think it's quite important to get that message out there, that this is a course suitable for anyone who is living with any longer term health issue, well, whatever that might be. So it's the same programme that we've delivered for 20 years in Wakefield. But obviously it's a different clientele. But the idea with this is that people come together who have all got long COVID symptoms, rather than a mixture of people within a group who might be living with different health conditions. But the idea behind the programme is that people, although are very different individually, of course, that you share very similar issues. So although I don't live with long COVID, fortunately, I live with MS and type 1 diabetes for over 40 years. So my part within the service is coming from that peer support angle. So the supported self-management course, the sessions are just an hour and a quarter. twice a week and for 6 full weeks, and they learn tools and techniques as they go along. If we just look at the next slide, please, it will just show us what we expect people to what people need to know about what it offers. So there's a self-management toolkit. That's basically all the topics that are in the course, and the idea is to use the appropriate tool to manage a symptom. So it's about a common symptom cycle, which I'll have a look at in a minute. But the thing is as well, that's most important that people have said on the current course that they are getting out of this, is that chance to meet and to share with others who are going through similar circumstances. So that's been really valuable, and they're opening up quite a lot about their feelings and finding ways to resolve them, looking at different tools and techniques to support them. So that's been great so far. And it is a supportive programme, so it does build on tools. So we want people to set realistic goals so that they can tackle issues that they face on a daily basis. So using SMART goals, basically. But also then looking at tools for problem solving, because when things don't go to plan, what can we do about that? So using a 7-step approach on how to solve any problem that might crop up in everyday life. So lots of things that are general and basic to everyday life rather than specific to COVID, but all these issues people are facing as well with living with long COVID. About managing physical activity, how can you get a safe return back? So we're working with our colleagues as well to make sure that what we're talking about is evidence-based and it is appropriate. Making decisions, because people have to face that in everyday life, but particularly with COVID, and maybe facing issues around making specific decisions about treatment, challenging negative thinking, which is a common part of living with a long-term health issue, I can assure you. So challenging negative thinking is quite an important skill. We talk about the benefits of healthy eating, and we talk about communication skills, because I think there are issues a lot of people have raised who are living with long COVID about communicating with healthcare teams. And you can see on the toolkit there, working with healthcare professionals is one of the tools that we talk about, because it can be quite difficult to get the most out of that appointment in the short amount of time that's available. So it's about working with teams and communicating with family and friends as well about people's expectations and how they can help people who are living with COVID to get the best out of their life. So they're the tools that are in the toolkit. So that's basically all the subjects that are covered. I've got a list of a course overview if anybody would want that emailing out if you're interested. But the idea is to use the toolkit to beat the symptom cycle. So that's where all the common symptoms that people experience, whether they're living with long COVID or whether they're living with another health condition, those are the similarities, and that's how the course works. So it's finding the right tool to break that. So for example, fatigue, you might use physical activity, going for a walk, etc. When you're fatigued, it sounds odd, but it can actually be a good tool to use. Or it might be using some relaxation to stop that interaction between the shortness of breath from the difficult emotions at the bottom of the cycle. So it's explaining it doesn't go around in circles, it goes in all directions, and it needs to be broken continuously. So it's trying to get people to build their skills to be able to do that in a variety of situations. So if you just look at the next slide, it's around how do people come into the service. Anyone over 18, we're currently only commissioned to deliver services for adults, unfortunately. So anyone over 18 with post-COVID symptoms of 12 weeks or more. A lot of referrals come to us through secondary care, through the COVID pathway, but we're also open to referrals from self-referrals and from GPs, people who are not accessing support at a clinic. So this course is valuable for anybody in any situation that's living with post-COVID symptoms. So they need to be residents of Wakefield district because of the commissioning guidelines, or have a Wakefield GP. But self-referrals, really, people can phone us, they can use the website, there's an inbox, or people, health professionals can refer on System 1 with the client's consent if they wish to refer to us. And there's not usually a waiting list of more than 4 weeks for a next course to start. because we've got a succession of dates that are booked in. Everything's on the Live Well Wakefield website, so we direct people to that if they want more information or dates about what's available, and that includes the course and the workshops. So that was, I'm trying to keep to time, so I don't know if there's any questions that are burning that they want to ask. I know it's a lot to take in. I'm sorry, I feel like I've garbled it along, but it's basically about peer support is being the overriding thing that people have said they've got out of it. So it's as much about the process and the experience of being on the programme as it is about the material. But sorry, somebody was going to ask a question, sorry.
That's all right. Do you have a question for Janet? Just looking, can't see anybody. Is there anything in the chat? No. If you want to ask a question, don't forget that you might be on mute. Well, you will be on mute because I think you're all put on mute automatically. So,
there's a question I think in the chat from Pam. Sorry.
I'm sorry, I can't see a question in the chat. Oh. And anyone, can a colleague help me out?
Hello. I was just wondering, Janet, if you are still able to take people onto the general course, or is it at the moment is your entire focus on post-COVID, so they're the only people joining your programs?
No, we're still delivering everything that we delivered before as well. So this is an additional service. So we're still accepting people onto the other courses, but the difference with this is it's specifically for people coming together as a group of people living with long COVID. So that then, because people have talked about issues in the community, stigma. So we thought it was important to run a course separately that was just exclusive, but we're still running the general course as well for people living with other long-term health issues as well as the other issues.
And how long does it take you to build a cohort for the other classes?
It's not actually had a massive impact on that, surprisingly enough, because obviously we're still just delivering to the same cohort. So I'd say roughly probably about, in an ideal world, 6 weeks to make sure we can advertise and recruit enough people.
Okay, thank you very much for that. Thank you.
Okay, thanks, Pam.
Thanks, Pam. Thank you very much, Janet. Janet will be staying with us, so if you can think of anything else, do ask at the end or put something in the chat. But now we've got Andrew, has got a quick ask of you, please.
Hi everybody. Yeah, you may remember a few weeks ago we did a series of videos and we asked for volunteers to take part in the videos, basically saying I wear my face mask so I can, or I've had my vaccination so I can. So it might be I've had my vaccination so I can go to the match, or I wear my face covering to keep friends safe, whatever it might be. Obviously, in a couple of weeks, we're hoping for the launch of the booster vaccination, and just in preparation for some communications around that campaign, we're looking at a similar video. So this time, we're looking for people who will be happy to say, I'm having my booster vaccination so that I can, whatever that can may be, you know, spend time with grandkids, spend time with family, friends. So it's just a reminder call, really, that if anybody is willing to take part in that video, please get in touch. I see Amanda from Featherstone Ravers is on the call, and I know Featherstone Ravers and Amanda have been really helpful with stuff. So I think she might be helping us. But anyone else on the call who will happily take part in that video would be good.
Thank you very much, Andrew. And I think it's a great opportunity for our champions to show the work that we're doing as well. So please do consider it if you can. Thank you. There's a couple of videos that you sent round to us, Andrew, wasn't there? One about Let's Keep Life Moving, which is a really useful one.
Sorry, yeah. Yes, there is. The Let's Keep Life Moving and a couple of other assets. I think there was one, the one yesterday I sent about sort of long COVID and stuff, which is quite worth a watch. And then there's also the booklet at the bottom, but I circulated, but I think that's going to be mentioned later on in the meeting.
Thank you very much, Andrew. So now we've got Darsha. Over to you, Darsha.
Hello, Tracy. Thank you. This is just a few slides just to give information about the current vaccination and what we are doing about children and young people over the age of 16. So you may have seen in the local media, but we are now offering the COVID vaccination to anyone aged 16 and over. As the comment was in the chat box previously, we are offering it to children who are 12 and over who have a condition that puts them into at an increased risk of complications from COVID. So those who live who are clinically vulnerable, but also if they live with somebody who is immunosuppressed as well. So next one, Tracy, please. In terms of where children can get their vaccination, it is split into 2 cohorts. So if a young person is within 3 months of turning 18, they will be invited to book appointment by the booking service, so they can book it themselves. And I know as a mother of a child who was turning 18, I had those very questions. Do I have to wait for his birthday? Can I do it a month before? Can I do it a week before? So it is from 3 months of turning 18, they can book on the national booking service. They can also be invited via the local vaccination service. Anyone younger than that, unfortunately, can't use the national booking service, but it is just a way of managing appointments. In terms of those who are 12 and 15, so parents and guardians of children who are 12 and 15, that cohort will be contacted by the NHS. It's most likely to be a GP. And as mentioned previously, it's for us vaccinating children who are 12 and above. All our sites had to go through extra checks and extra assurances and paperwork to simplify it in description. So that's why perhaps there might have been some of the feeling that we might not have had all of them, but there is absolutely going to be well, there is commitment, but there will be capacity to vaccinate those cohorts. Unfortunately, for the younger ones, we can't offer walk-in services. But I think the next slide. Thank you, Andrew. Yes, he is 18 and he has passed his driving test as well. So is coming out a bit more regular now. In terms of 16 and 17-year-olds, they can look at the walk-in appointments as well. So there is a link on the website. When you go onto the website, it does clearly state it as to which appointments are suitable for 16 and 17-year-olds. As a reminder for those who are 39 and below, it will be the Pfizer vaccine that they will be given. They don't need to be registered with a GP. They don't need to worry about an HS number. And what I didn't put in the slides that might be useful to also say is young people 16 and above can self-consent. So if parents are worrying about taking time off work, etc., young people can attend the appointments themselves. There is a general NHS site finder if anyone wants to find appointments wider afield. I know young people in particular, they are a bit more mobile than perhaps some of us, so there is that ability to use the link on the right hand side. So in terms of 16, 17-year-olds, at the moment, we are anticipating that a second dose will be given to them later on, but at the moment, we are looking at 1 dose only for the 16 and 17-year-olds. And that is a recommendation from the Joint Committee for Vaccination and Immunisation. And it will give them a little bit more time in terms of gathering and determining the suitability of the second dose. And just reviewing the latest information to provide that advice. For young people who are called in as part of the 16 and 17-year-old programme, and again, in terms of the age groups, for those who will receive first dose of being at the age of 17 and 40 weeks, may be brought for their second dose as part of the Turning 18 programme. So those who are at the older part of the cohort may fall within that. And those who we've been vaccinating as part of having underlying conditions. So do you remember when we were going through the different cohorts, those 16 and above with underlying conditions, they will have both doses. Next one, please. One question that I have been coming across from young people is, I've had COVID, do I need to have vaccine? Yes, that is the straight answer. So please still come forward for the vaccination. In terms of more information, on the next slide, we've got a sheet of frequently asked questions. So these questions and some additional ones are on our website. Please do access this, please use it, whether you want to share it with loved ones or within your networks or organization or newsletters, or to support you to answer any of the questions. Please feel free to use that. In terms of leaflets and publications, there is a Public Health England leaflet around vaccination guide for children and young people, but that some of you might find useful. The next few slides, and we will go through them quickly because we are 1 minute over, but I really wanted to introduce a movement which is a movement that is challenging racism and addressing health inequalities across our area. It is wider than just Wakefield. We are working across the West Yorkshire and Harrogate area, and it has been introduced and launched by the West Yorkshire Integrated Care System together with West Yorkshire Violence Reduction Unit. It was launched on Monday, so we are very much in the beginning of this movement, and we are preparing for Wakefield-based launches. In terms of some of the next few slides, we will just whiz through them. But it's just to say that it has been based on experiences of colleagues who have been impacted by racism. So the quotes and information that we are sharing has been developed and co-produced with them. We have produced quite a lot of information that is available. There is a link to the partnership website where you can download, have a look of what is happening, download some resources. And it is looking at sharing the messaging. So the next few slides, as you can see, some of the messaging that has been developed based on the feedback and lived experiences of our colleagues. It does then move on to what we would love you to do. So we are looking at overall pledge, looking at how we can encourage people to speak up against racism, and really the slogan and the strapline is rooting out racism. For next one is how you can help, and that is a really important slide as much as all the others have been. But there is a way of taking part, so you can register to the movement. You can use a Twibbon for your Twitter profile, help us sharing messages, as well as downloading selfie banner. So we would love some quotes, groups and individuals downloading the banner and putting a quote out. If you are able to do and willing to have a selfie, that will be absolutely fantastic. We have prepared a newsletter article that if you do have ways of sharing information, we will provide you with that and we'll share it afterwards. We do have pin badges on order. We are hoping we will have loads and loads and loads that we can share, but it's one of my colleagues said in a call just previously, everyone wants a freebie, but it is the sharing the messages. And you have, as a group, been absolutely amazing in getting messages across communities as well as giving us feedback. So really the question is, can you help us with this crucial issue? How can we get it out? How can we gain the support? Thanks, Tracy. This is just a link to additional information in the report that supports this movement.
Thank you very much, Darsha. And I'm guessing that if people want to take a selfie, would you like to have a copy of that? Would you like people to email you their pictures?
That would be absolutely fantastic. If there are any selfies with the banners, any quotes, we can either attribute it to individual or group. If you don't want full name, that's absolutely fine. And I'll pop an email address into the chat box to send it to. That will be fabulous.
Thank you very much. Thank you, Darsha. And finally, and I'm sorry we're a bit over, but we've got quite a lot of information to share today. But a couple of our champions, actually 3 of our champions, raised issues recently about access to GPs and primary care. They were very clear that they weren't complaining, and they were definitely not complaining about the service from the NHS, because, you know, they appreciate the work that they're doing. It was just simply raising issues to look at, can we look at solutions together, which Dash and I have chatted about, and thought that that was absolutely appropriate for our champions to do, and we thank them very much indeed for raising them. And we wanted to just check with the rest of you if you've also had any issues about availability of GP appointments, about having to have long waits on the telephone waiting for your GP to answer, or any other issues with GPs or primary care that you would be willing to share with us, and whether you'd like to have perhaps a meeting with Dasha and a representative from primary care to talk about some of the issues and see if we can look at some ways forward to improving the experiences of other people like yourselves. So I guess that's over to you. If any of you have had any issues or know of any people in your community or their networks that have had issues accessing GP appointments, now's your chance. Please just give us a yes or a no.
Yes.
Yeah, and we've got one in the chat box. Happy to get involved in the GP conversations. A couple have had to leave. Thank you very much for attending. Janet, yes, would you like to say something?
Yeah, just that some of the participants on the courses are saying that they're struggling to get appointments with the GP, and that there's no face-to-face appointments yet, which they feel will be beneficial for them in particular. That's what the main issues they've raised.
I just pop in. It's great. I'm just liking all the yeses, so that's fantastic. I'll put my email address, or better yet, I'll put our engagement team email address in, unless Tracy, you are happy to receive them. I'm happy either way.
I'm happy to receive them either way, yeah, however.
I'm just thinking if there are certain things that you are coming across, that would be really good to know. Not that we want to spy on our practices, but it is really helpful to understand where those experiences are happening as well. So that would be great. Just to go to Janet's point in terms of face-to-face appointments, we do have, we are offering face-to-face, so all practices are offering face-to-face appointments, and they have been asked to offer face-to-face appointments. I think from the latest report that I've heard, we're doing quite well nationally on appointment availability, and where a person needs to be seen clinically. So if there is a clinical reason for the person to be seen face-to-face, there will be offered face-to-face appointment. That said, I myself are hearing that people are having difficulties. So it's that understanding the whole journey, because sometimes it's the feedback about, I wasn't able to get an appointment, but does the experience start right at the beginning when you are trying to make the appointment?
Yeah.
So do you think a separate meeting might be useful, Dash, with about our champions, and is there an appetite for a meeting? And we don't have to record it, it can be an online meeting just to chat with people, or would you prefer to just send in via emails?
I don't mind, I'm happy absolutely either way. I think sometimes chat is useful to understand, and I know people are really busy. Sometimes it feels too busy to be writing sometimes.
We've got a few yeses, so I'll set up a date, and it might be that we use one of the regular Wednesdays to do that. So yeah,
Sorry, can I just mention, Thursday? That would be lovely, because obviously there's a lot of things that I would like to discuss as well, because we've talked about a lot of people going through COVID, and when you've been through it yourself and you've had that first-hand experience of how you get treated and how the response you get from primary care. I mean, I'm still recovering from long COVID. I've been through a lot. I never knew that I would actually get to where I am now. I mean, I'm happy to talk about it to anybody, because it makes me emotional when I talk about the experience I went through, trying to stop myself from going to hospital, so I could just sort of help myself at home and save the time for the NHS as well, really, because obviously they've got enough going on. They don't want another patient struggling with COVID. But the primary care, I mean, I'm speaking from my own experience. I had the doctor who just put the phone down on me, that you've got COVID, just deal with it, basically. And it got me that upset because I was that emotional and my chest was really awful because I had phlegm coming up. He made me describe it. I described it, and he just didn't want to know. And my husband was sat next to me and he goes, you need to ring them back again and just find out why they've done that. So when I did ring back 111, and they did eventually, they apologized for whoever behaved like that with me, and they were happy to. Second doctor, he phoned me straight away. He prescribed me antibiotics, which I'm telling them, he could hear my voice was not right. There was something not right on my chest. For a doctor to recognize that over the phone, I think it would be quite easy for them to recognize, especially when you're describing what color it is and how it is, and you're not able to keep anything down. Everything's coming back up again. And I just feel like, not just me, there's probably number of people that have gone through the same sort of situation, but because me as being a COVID champion for the past year, nothing like this has happened to any members of my family or me and myself. This whole 6 weeks of the holidays, our family's gone through this COVID period, and it's not been nice at all. I mean, there's other things, I know we're going over time now, but there's other things I'd like to discuss with Darcy, if that's okay, later after the meeting.
Yeah, no, it's absolutely fine. And I just wonder whether, you know, I think that just summarised really nicely that we can meet it rather than leaving things on emails. But for those who are wanting to just share feedback, that will be absolutely fantastic. So yes, we can have a chat after the meeting. That's no problem.
Thank you very much. So I will set up a meeting. If you can't make the meeting or you want to send it information via email, you can send it to Dasha or myself, and I'll put the details on the after meeting email along with all the other links. So thank you very much indeed to all of our speakers, and thank you ever so much to all of you for joining us today. Please do help us to share these important messages. Thank you very much. See you next time.
Thank you.
Thank you.